Hi everyone, we're going to go ahead and get started. I'd like to welcome you all to our Health in Mind webinar. We're excited you all could join us and hope that you enjoy this webinar. My name is Alex Scheibel and I am the Policy Analyst at Healthy Schools Campaign, which is the organization that's hosting today's webinar. And we'll tell you a little bit more about Healthy Schools Campaign in a couple minutes, but I just wanted to review some of the basics for today's webinar. In addition to this webinar, we're also hosting 3 more webinars this spring, and you can register for the webinars online at the link that's on the bottom of the page. We're going to send it out to you as well, and we will be following up this webinar with an email with that information if you're interested in registering for those additional webinars. Today's webinar is going to run for about an hour, and a recording of this webinar will be available to view. And we'll, as I said, be sending out an email to all participants with information on where you can view that webinar. It'll be archived on our website, in addition to all of the presenters' slides from today that you'll be able to download. Next slide. We're going to save about 15 minutes at the end of today's webinar for questions and answers. And so what we'll ask of you all is if you could just type in your questions to that question box on your control panel and send them in throughout the presentation. We'll collect them, and then during those last 15 minutes, we'll go ahead and ask them of our presenters for today. Next slide. So we have a great lineup of speakers, and we're excited to get started. So I'm going to turn it over to Mark Bishop, Vice President of Policy and Communications at Healthy Schools Campaign.
Thank you, Alex. Again, thank you everyone for joining us. It is our honor to be here. A little bit about Healthy Schools Campaign. For those of you all who are new to Healthy Schools Campaign, we are a not-for-profit located in Chicago, Illinois. We work on environmental health and school health issues on the common sense notion that a healthy student is going to be a more successful student. While a lot of our programs are based here in Chicago, a lot of our work has scope that's national in impact, and that's what we like to think about is the basis of work that we do being on the ground, yet we work on policies that have a broad and extensive outreach. We're very excited about today's presentation. We've got 2 great speakers. We're going to have Richard Hamburg, the Deputy Director of the Trust for America's Health, who's going to be speaking about the prevention strategy in our healthcare system today and the important role that schools play within providing prevention services. And then we will have Dr. Charles Basch, who will be speaking about educationally relevant health disparities and what education's role is in trying to reduce these disparities and ultimately improve educational outcomes for all students. But that brings us to the question about what we are doing at Healthy Schools Campaign and what we call Health in Mind. Health in Mind is our initiative is an initiative of the Healthy Schools Campaign along with the Trust for America's Health. While educators know that healthy students are better prepared to learn and succeed in school, current health and education policy missed several simple yet vital opportunities to boost academic success through health promotion and school wellness. This initiative encompasses specific, practical policy recommendations that our country can implement to make immediate and important improvements without significant expense. So that's what we're doing here today, is we're talking about these issues that are so important to promoting health within our school setting and how relevant it is to make sure that our schools are successful. But more than just that, I want to highlight a couple of areas of what Health in Mind is. It is a collaborative effort. We have reached out and interacted with more than 50 organizations nationally to engage with them on what are the best practices and what are the important and key policy recommendations that we want to be making to ensure that we are promoting health within our educational system. Now, I won't say a second, we are going to be releasing a report to the Department of Ed and Health and Human Services this May 9th. And when we release this report, we're going to be making public the recommendations that we're making to, again, to broaden and to expand health and wellness promotion within our schools. And ultimately, this is more than us, and this is more than just the 50 organizations that we work with, but we want your support, and we hope that everyone who is here listening today can join us. There is a link that is shown that we will push out to you in a few moments where we would love for you to take a look at our vision, sign on either individually, or if you're an organization or represent an organization, have your organization or association support the work that's going on as we deliver this message to the Department of Ed and Health and Human Services. Having said that, we're going to move on. I'm going to introduce Richard Hamburg first, but before I do, I would love to ask the question of the audience. And the question that we're going to start with, is, should be up on your screen right now. What is the biggest barrier to providing health promotion services in schools? We listed a series of 4 options, but in addition to those 4 options, there's an other box. So fill out what you think. We'd love to hear from you. I'm going to introduce Richard. Richard Hamburg is the Deputy Director at Trust for America's Health. He oversees public policy initiatives, advocacy campaigns, and internal operations, and has more than 25 years' experience as a leading health policy advocate. He has led the Trust for America's Health efforts to ensure disease prevention is a centerpiece of health reform and has been instrumental in TIFA's work on obesity prevention, building national pandemic flu and public health emergency response capabilities, and increasing support for public health priorities and budgets. It is our honor to have Richard. And having said that, I'm going to close our poll. And we're going to say it looks like 52% of you reported that health is not prioritized. 7% say other. So if you have other, if you said other, or if you have something that you'd like to say about barriers for providing health promotion services, please give it to us in the question section. We'd love to hear and maybe share with that at a later point. So Richard, I'm now going to offer the floor to you. So Richard, if you'd like to get started.
Thanks, Mark. Appreciate it. Glad to be here today. So next slide, please. We're an organization, Washington, D.C.-based, nonprofit, nonpartisan group that has as its goal of protecting the health and community, or the health of and communities around the country, and focus on all things public health around chronic diseases, infectious diseases, emergency preparedness, and put out a series of reports. You'll see a picture there of one of ours, Prevention for Healthier America, but we put out maybe a half a dozen reports a year on different aspects of public health. Next slide, please. So overall, from a school-based setting, a lot of the work that we do in partnership with many other national organizations are focused on children in schools, and you'll see here a couple of key principles that guide the work that we do, and that many of you, I'm sure, are involved in, trying to find ways to help schools and educators be healthier, more active. Certainly, in our advocacy efforts on Capitol Hill, it's become increasingly important to make the case that healthy students get better grades, more likely to attend school, more ready to learn, and that students are meeting Healthy People 2010 guidelines for vigorous activity get higher grades. And we're dealing with the unintended consequence and budget cuts of less physical activity in the schools, and I think at the state level and at the federal level, we're certainly turning the corner and are beginning to correct some unintended consequences of some of the policies put in place in the last 10 to 15 years. So we're excited about that. We highlight a lot of the policies around wellness and public health, nutrition, physical activity in the school setting in an annual report that we put, obesity report that we put out. Next slide, please. So one of the exciting things that's happened in the last 2 years, and I'll highlight 2 of them. One is the establishment of a national prevention strategy, and the second is the implementation of a mandatory fund dedicated to wellness and prevention. So approximately 1 year ago, Obama administration released first ever national prevention strategy, and it was meant to recognize that good health comes not just from receiving quality medical care, but also from clean air and water, safe work sites, healthy foods, healthy children. And the strategy was developed by a National Prevention Council composed of 17 federal agencies, consulted with outside experts and stakeholders. And at the time of the release, Health and Human Services Secretary Kathleen Sebelius called upon this effort to help us transform our health system from a focus on sickness and disease to a focus on prevention and wellness. And so that's what we have on the table for the first time, a comprehensive national prevention strategy involving at least, at the current time, 17 federal agencies. Next slide, please. So you'll see a lot of the agencies that are involved, and if you pick an issue like obesity or childhood obesity, clearly a priority issue for the Department of Health and Human Services, but the Department of Agriculture in setting nutrition standards in schools sold in food sold in schools, they have a piece of this. Department of Education, certainly they've reauthorized the federal legislation several times over the last couple of years, and increasingly we've seen a dedication to wellness and public health. The Department of Transportation, there's a huge investment in what's called the Safe Routes to Schools program through that department, hundreds of millions, actually billions of dollars over the last couple of years. So, you can go kind of agency by agency. One agency that doesn't appear here that probably should is the Department of Interior. I was speaking to National Group, the National Park Service last year, and it's amazing, the amount of programs that they have dedicated to wellness and prevention, and, I would hope in the future that they would be around the table as well. Next slide, please. So this national prevention strategy has 4 pillars: healthy and safe community environments, clinical preventive services, empowering people, eliminating health disparities. And you'll see around the outside here what the specific strategies are: injury and violence prevention, reproductive and sexual health, mental and emotional well-being, active living being one of the more important ones. And then across all of those, the elimination of health disparities is critically important. Next slide. So under the National Prevention Strategy, we're looking at the whole concept of health in all policies, that, again, health is not just an issue to be addressed in state and local health departments, but everyone has a role: federal agencies, state, local agencies, and nonprofit, non-governmental organizations as well. So, clearly, when you look at housing, transportation, labor, education, they can all be called upon to promote prevention-oriented environments and policies, and they all contribute to the nation's health. Social, economic, environmental factors all influence health. I mean, that's an obvious. And then individuals with quality education, stable employment, safe homes, neighborhoods, etc., are going to live healthier and longer lives. So, we want the concept out there in this national prevention strategy for a national level, sets as a priority clean air and water, healthy housing, promoting physical activity, promoting nutrition, promoting injury-free living, and the list goes on and on. Next slide, please. So specifically, one of the priorities in this plan is safe community environments, healthy and safe environments. So a healthy environment, as we like to say, can make the healthy choices the easy choices, and that's one of the roles of government is removing barriers. Certainly personal responsibility an issue. It's a family issue. It's a school issue. But there are roles for government. There are barriers that state, local, federal government agencies can remove, and it's not just a money thing. Certainly issues around safe buildings and parks. A good example of a health in all policies is hey, it's great to go into a neighborhood that had a let's say a park and a playground that wasn't being kept up and disarray, disuse, or misuse, and to bring in some funding to build a park or to build better equipment. Well, that's a great thing, but if there aren't sidewalks connecting neighborhoods to that park, that doesn't quite do it. If the park isn't safe, that doesn't quite do it. If the community didn't buy into the design and potential uses for the fields, that could present problems. So that's kind of a classic. It takes a village. It certainly takes a community to work together to promote healthy living. Next slide, please. Specifically, in the National Prevention Strategy, there's a lot of recommendations that are related to schools. So we've been talking a lot here about nutrition, physical activity, also tobacco-free environments. 20 years ago, the concept of having a tobacco-free environment in the school, shockingly, was quite unique. And little by little, we were able to make inroads, and over time, our schools are tobacco-free. Some of that happened school by school at the local level, and some of that happened from some federal legislation that promoted that had a bit of a carrot and stick to ensure that schools went smoke-free. We're also talking about facilitating access to safe, accessible, affordable places for physical activity in schools and playgrounds. Gave a presentation yesterday. I held up a key ring that I have and had one small key on the key ring, and it was a key that I have because I coached during the summer and the fall our local high school baseball team, and that field is locked. That field is locked during the day. There's a lot of reasons for that. There's liability reasons, there's safety, but bottom line is a major barrier. You can't tell kids to be physically active and then in a public school on a public property have it locked. Same goes for the use of the facilities. In the evenings, after school, weekends. We need these joint use agreements to promote the use of schools for physical activity. I mentioned safe routes to schools. Supporting walking and biking to school programs and work with local governments to select school sites that can promote physical activity. And then, of course, there's drug abuse, adopting policies and programs to decrease the use of alcohol, other drugs on campuses. So throughout the national prevention strategy, there are school-based policies to be implemented and to be supported at the federal level, the local level, the state level, and by individuals and families as well. Next slide, please. So the other piece is the National Prevention Fund, and put a report out 2 years ago or 3 years ago that found that that at the very least we need to invest an additional $20 billion a year in public health across the country, and pointed out that Medicare and Medicaid, in other words, programs that help pay for medical care are mandatory programs, but that public health programs and prevention programs are discretionary programs. And over time, that means a very unreliable source of dollars. So as part of the Affordable Care Act, kind of a concept that was an academic concept at the time that built a lot of support through hundreds and hundreds of national public health organizations and partner groups as well, and we ended up with a dedicated fund. Next slide, please. Began as a fund that would provide $15 billion in additional dollars for transformational type programs. It was to climb to $2 billion a year. It will still climb to $2 billion a year, but unfortunately, Congress to help pay for what we call a doc fix, a payment problem on the Medicare side, that the fund will now grow more slowly. It'll be $1 billion a year next couple of years, and then slowly but surely build up to $2 billion. So again, that was meant to be new money for transformational public health programs. Next slide. And here's a map. These are where the dollars from the Prevention Public Health Fund are going across the nation. So we're talking healthy, more than healthy new commitments of dollars, and this is just for 1 year. This is 2011. From $1 or $2 billion in some of the smaller states to as much as $40 million in California. But everybody is getting money through this fund. Next slide, please. And then you'll see the types of programs. I'll skip over the community transformation grants for a moment, although that is the largest investment. It was $145 million of the $750 million that was invested, that was available in fiscal year 2011. So it's funds for tobacco prevention, for environmental programs, for public health workforce, for infections in hospitals. Next slide, please. For environmental for laboratories, state and local laboratories that will help us react more quickly to foodborne outbreaks and infectious diseases like the pandemic flu. And so you'll see some of the other dollars, money for a national youth fitness survey, for education and outreach, and for an early childhood obesity program. Next slide. So to begin to wrap things up here, this Community Transformation Grant Program is a new program. It used as a model For example, the YMCA's federally funded Pioneering Healthier Communities program, where local organizations all got together to come up with some priorities for community change. And those are state and local public health groups like the Y and the Heart Association, the Cancer Society, but also the local Chamber of Commerce, the school boards, the PTA. The idea that community needs to work together to create healthier school environments, healthier food options, physical activity opportunities, and develop programs that are targeted in addition to safety, smoking cessation, and so on. Next slide, please. So I just want you to be aware that these programs are in place. There are over 60 of them. Information is available on publicly available websites and through our organization of which organizations are spearheading the individual programs. In some places it's a state, in some places it's a large county health department, in some places, California for example, it's Public Health Institute. It's a non-governmental organization. So the money is available to all of those different bodies. To get the money, you have to show that you have a strong coalition that involves multiple organizations, like I mentioned, including those, school nurses and PTAs and high school, local principals, school boards, to define concrete, achievable targets, and specific objectives for meeting these strategies and moving public health forward. These leadership teams must have the ability to coordinate with all of these multiple community sectors. The good news, in addition, is at least 20% of the money goes to frontier and rural areas. 50% of the dollars that go out directly to the states and the large health departments are going to be re-granted to local organizations to do this work. Next slide, please. And then finally, just in summary, we talk, concentrating a lot on physical activity and nutrition, but it's all things public health. There are certain achievable goals. There are certain objectives that we're trying to reach through these funds, and one of the key objectives is to decrease obesity levels by 5% over 5 years, to decrease heart disease and stroke by 5% over 5 years, and same thing for tobacco use. Last slide, please. So, in support of this fund, again, a classic health in all policies. It's not just public health groups; it's education groups. In support of this fund, we have the National Education Association, Association of School Nurses, Association of School Administrators. We have some of the big unions. SEIU, AFSCME, we have medical providers, we have business groups, we have faith-based groups. I think it's important to note that that the support needs to be broad, that the priorities and the deliverables are broad, and that there's definitely a place for everyone on this call to try to figure out how to plug into the National Prevention Strategy, implementing that, and how to plug into the Community Transformation Grant. So let me stop there.
Thank you so much, Richard. I really appreciate your time here today. Now, with an understanding of the role of prevention in our new healthcare system and the role the schools are there, the next speaker we're going to ask is Charles Basch, who we're going to ask him to speak to the research that he has done around educationally relevant health disparities and the roles that schools can take to address those. Before I give his introduction, I want to do a quick poll and get a little bit more feedback from the audience. And I'm going to ask a question of everybody, so take a look at your screen and say, the question is, what do you think is the most important, what is most important to support a healthier school environment? We have 4 options, and again, if you do not see what you think is most important, please let us know through that questions tab. Now, I will introduce Dr. Charles Basch. Dr. Basch is the Richard March Ho Professor of Health and Education at Teachers College, Columbia University. He specializes in planning and evaluating health education programs for urban minority populations to reduce health and educational disparities. His work has been diverse with respect to population groups, including young children and older adults, and a range of disease topics, but has a common theme of translating research into practice. Dr. Basch is the author of the report, Healthier Students Are Better Learners, which provides an in-depth look of the issues we'll be discussing today. And of course, when Healthy Schools campaign read, "Healthy students are better learners," we realized that this was the guy who knew what he was talking about and who got it. And we realized that this is someone that we wanted to get to know better, and we are proud to say that he's a colleague and a friend of ours. So Dr. Basch will be giving the floor to you in just a moment. So let me close this poll and say it looks like 42%, the highest, said increased parent and community involvement is one of the most important things that we can be doing to support a healthier school environment. Interesting. All right, so now Dr. Basch, I hope you are going to be taking over. We're going to be giving you the role. So Dr. Basch.
Okay, Mark.
You don't have to show your screen.
Right.
There you go.
I'm about to do that. How's that?
Beautiful.
Okay. Thank you very much, Mark and Alex, and thank you for all the work of the Healthy Schools campaign. It's been a great organization doing great leadership for this cause. So my talk is much more narrowly focused than Richard's, and it's focused specifically on the educational achievement gap and the role of school health in helping to close the educational achievement gap. So during the last several decades, lots of different things have been attempted to address the achievement gap, but no matter how well teachers can teach, no matter how we fund schools, how rigorous curricula are, I think a message we need to get out to educators is these different education reforms are going to be jeopardized if students are not motivated and able to learn. And what the research shows really clearly is that educationally relevant health disparities affect motivation and ability to learn. Now, there are clear connections between health education and social economic conditions, even though these problems tend to be interrelated and cause one another. The solutions up till now have been fairly isolated and fairly siloed, and I'm glad to say that I think that's starting to change, and there's good hope for interrelationships and avoiding duplication of services as we move forward. My focus is specifically on urban minority youth from low-income families, school-age youth, and health problems that can be feasibly and effectively addressed through schools. That's not to say that there aren't other populations with needs, and preschool populations are clearly a high priority, but this is just the way I have delimited my talk today. And I'm going to first talk about health factors that affect educational outcomes, then very briefly talk about effective and efficient school health programs. So first, health factors that affect school programs. How do you figure out what those are? Well, first of all, I only wanted to focus on problems that had disproportionately affected urban minority youth and were highly prevalent. I only focused on factors for which there was really evidence that they had causal effects on educational outcomes, and only on problems for which there were programs that have shown feasibility in schools to be addressed. So based on that, I identified these 7 what I call educationally relevant health factors: vision, asthma, teen pregnancy, aggression and violence, physical activity, breakfast, and inattention and hyperactivity. All of these problems are highly prevalent. Vision is estimated to affect about 1 in 5 youth. Asthma is the most common chronic disease affecting youth, about 14%. That's about 10 million youth under the age of 18. And a staggering 1 in 3 female teens is expected to become pregnant. Violence is pervasive in youth culture. About 25% of adolescents report being bullied at school. These data are all based on national data. About 2 in 3 high school students don't get enough physical activity, and about 1 in 5 skip breakfast on any given day. Hyperactivity, inattention and hyperactivity, ADHD, is the most common mental and behavioral disorder affecting youth, which is about 8% of 6 to 17-year-olds diagnosed with this condition. That's about 4.6 million young people we're talking about here. Now, all of these problems, while highly prevalent, all disproportionately affect urban minority youth. And I'm going to quickly go through a set of slides just to show you that. Here we see rates of visual impairment, again, higher rates among Black and Hispanic youth and those from lower income families. This next slide shows that, for example, prevalence of asthma is about 45% greater among Blacks compared with whites, and the second two bars show the importance of disaggregating the Latino population, and here we see that birth rates for Black teens are 3 times as high as white teens, and for Hispanic teens are 4 times as high. And these are staggering differences that we're talking about. This next slide talks about the percentage of high school students that were in a physical fight, and that's in the preceding year. It's about 35% overall, but you see that, again, clear disparities between Blacks and Hispanics and the white population. This next slide is informative. It talks about the percentage of high school students in the United States who did not go to school in the last month, one or more days in the last month, because they felt unsafe at school or traveling to or from school. And again, you see clear disparities where Hispanic youth are more than twice as likely to have missed a day in the past month because they're afraid to be at school or travel to or from school. Here you see clear differences for female high school students in rates of physical activity and breakfast consumption. We see that there are disparities between Blacks and whites in regular consumption of breakfast, and while those disparities decline in terms of relative percentage, absolute percentages, the actually relative differences between Blacks and whites increases as females age from age 9 to 19. And then finally, the ADHD rates are higher among children in single mother head of households and those with much lower compared to much higher incomes. And I go through these slides very quickly because I don't think there's a need to belabor them. They're really not controversial. They're based on national surveillance systems, and we've done a very good job at documenting the problems. And these problems, unfortunately, and these disparities, unfortunately, have really persisted for decades. The next topic that I'm going to talk about, however, is based on research conducted largely in the last year. And that is, well, how and why did these specific health problems affect educational outcomes? And I think through looking at the literature and empirical studies, it's very clear that there's at least 5 causal pathways through which these specific health problems affect educational outcomes, and those are sensory perceptions, cognition, school connectedness and engagement, absenteeism, and dropping out. Sensory perceptions is just being able to see well and hear well. Cognition is thinking skills, being able to remember things and pay attention, make decisions, and solve problems. Absenteeism and dropout are also pretty obvious factors. If you're not in school, you have limited opportunities for learning. The one here that I think is less well known is the importance of school connectedness. And the research shows that the children who are connected with school, that is, they feel like they belong in school, they feel like their peers and the other adults in the school care about them as people and as learners, those students are much more likely to succeed in school academically. Each one of the educationally relevant, each one of these causal pathways is affected by multiple problems. So, for example, children who can't see as well because they might have a problem like hyperopia they're going to have a much harder time acquiring basic skills in reading, being able to distinguish letters and learn how to pronounce different syllables and so forth. It's going to be much harder if the letters are all blurry. It's hard enough when you can see clearly. Children with ADHD, for some reasons we don't understand, also seem to have more visual problems, and they too have problems seeing. Now, again, these untreated vision problems are quite prevalent, particularly among children from lower income families. Now, here you see that cognition is affected by 6 of the 7 factors. Here, vision problems don't necessarily affect only ability to see, but with respect to cognition, we're talking about visual motor integration, the connections between your eyes and your brain. And if you have these kinds of visual motor problems, it makes it harder to see, to translate the things you're seeing on a blackboard or on a page of print and process that cognitively. Asthma affects cognition because asthma has a strong effect on sleep. And in the last 10 years, researchers have shown the importance of sleep and how important it is getting a good night's sleep in terms of your ability to pay attention and focus your mind. Aggression and violence are a distraction from cognition because they result in depression, they result in intrusive thoughts, they're distracting, and when there's disruptive behavior in the classroom, it not only affects the children who are disrupted, it affects all the children in the classroom. Interestingly, with respect to physical activity and cognition, it's only the last 10 or so years that the neurosciences and molecular biologists have shown empirically what the Greeks knew 4,000 years ago, and that is there's a strong connection between a sound body and a sound mind. Breakfast is recognized for its importance on cognition. It's not surprising that principals send home a note before the test advising parents to make sure that children not only get a good night's sleep but eat a good breakfast on the day before the test. Well, it's obviously a good idea that they eat a good breakfast on all the other days of school as well. And by definition, inattention and hyperactivity by definition, the symptoms have to do with cognitive abilities, thinking abilities, being able to pay attention, focus attention, remember things, and solve problems. Likewise, all 5 of these 7 factors have direct effects on connectedness. Think of the child who can't see well. No matter how hard they try, they're still not succeeding in school. What's going to be the result? Probably feeling kind of demoralized. And if you're demoralized, you're more likely to disconnect from school and not feel engaged. Likewise, the children with asthma, and I should have pointed out earlier when I talked about disparities, the asthma disparities are really less important than the poorly controlled asthma disparities. And urban minority youth clearly have much higher rates of poorly controlled asthma, as indicated by overuse of emergency room and overuse of rescue medications. So children with poorly controlled asthma are much more likely to have comorbidities of anxiety and depression in school. Not surprisingly, they're less connected. By definition, you'd think if you attend a school characterized by aggression and violence and you don't think people care about you there and you don't belong there, it's not going to be a kind of place where you're going to feel very connected. Physical activity also provides wonderful opportunities for connectedness and engagement, for teamwork, for cooperation, but oftentimes there's an overemphasis on competitive sports and a lost opportunity to really capitalize on opportunities to help children feel connected to school. And I think one of the saddest aspects of ADHD is too often many of these children just don't have friends. They have problems with their relationships and they don't feel connected and engaged in school. Likewise, here you see that many of these problems affect asthma. It's not controversial. Children with asthma miss more days of school. I showed the slide that showed when children attend a school characterized with high levels of aggression and violence, absentee levels are higher. When children are physically active and have good dietary practices, their immune systems are stronger, they're less likely to miss school. And children with inattention and hyperactivity are not only late more often, they miss more school. In the literature clearly shows that teens who become pregnant are at a much higher risk for dropping out of school, and children with ADHD have a much lower likelihood of completing high school and going on to college. So what can schools do? Well, it's not really rocket science. Vision screening is pervasive in the nation's school, but the extent of follow-up is really not sufficient to ensure that children get the services they need. On-site provision of services is an example of what can be done. Here you see a list of 4 things that can be done to address the asthma in schools, case management, elimination of triggers, asthma education, and safe opportunities for physical activity. With respect to teen pregnancy, we're talking about teen pregnancy prevention should start in kindergarten. We're talking about effective skills-based education, social-emotional learning, and then in the higher grades, contraceptive services for youth that are sexually active. And the data clearly show that that is a majority of youth we're talking about, and social services and health services for moms that do become pregnant. Similarly, for aggression and violence, we need to cultivate a supportive social climate where youth feel safe in their schools, where we have skills-based programs, and such programs definitely exist. It's not controversial. These programs exist, but they're not being implemented in the nation. Schools, likewise, for physical activity programs, standards-based physical activity, in-class movement and recess programs, intramural and after-school programs, and support for walking and biking to school. And not only universal breakfast programs, but allowing students to eat in the classroom. So many school districts lose money from the federal government because the rates of participation in the breakfast program are so much lower than their lunch programs, and we know a lot how to change that. And with respect to ADHD, there's a variety of things that we can do to help youth to not only control their symptoms, to make it easier for adults in the school to deal with them, but to actually help them succeed academically and socially. Now, it's not surprising that if a child can't see very well, if their eyes don't connect with their brain, they're going to have a much more difficult time succeeding in school. It's not surprising that if a child can't concentrate and use memory and make decisions, they're affected by ill nourishment or sedentary lifestyle, or if they're distracted by negative feelings, it's going to be harder for them to learn and succeed in school. If their relationships with their peers are negative, they'll be less connected to school and therefore less motivated and able to learn. If they're not in school because of uncontrolled asthma, ADHD, or because they're afraid to travel to or from school, they'll miss important learning opportunities. If they drop out because they're failing or faltering because their socialized belief that even if they complete school, there'll be no better opportunities, or they become pregnant and there are no resources in place that enable them to complete school while pregnant, and after they have a newborn, it's not likely they can succeed. If they can't focus attention and succeed socially, it's unlikely that they're going to succeed academically. One of the most important things I'd like to emphasize in my talk this afternoon, is that our funding programs and our policies tend to be very categorical, but many children are affected by multiple factors simultaneously, and there's a need for us to address these problems simultaneously, because if we address some without addressing others, we're going to be squandering our resources. We have to focus on multiple factors at the same time to have a coordinated approach. So how do we go about developing an effective and efficient school health program? And I really only have a couple minutes to give you a really brief overview of that. There is increasing recognition about the importance of health and education, but too often we don't have sufficient financial investment, efforts aren't strategically planned, programs are not high quality, and they haven't been effectively coordinated. So when I talk about strategically planned, I'm talking about maximizing the yield from investments, and I think people in schools want to maximize the educational yield from these investments. So they will be interested in implementing these programs if they can understand that if they fail to address these factors, not the benefits from their other efforts are going to be greatly jeopardized. Schools vary from one location to another, so there has to be specific priorities. This has to be an ongoing process and a fundamental part of schools, and there is a need, as your poll pointed out at the beginning of the session, for high levels of parent community involvement. There are many high-quality programs that do exist. Unfortunately, some of the most widely implemented programs in the United States with respect to school health have had absolutely no evidence of effectiveness, and we need to change that. There's many repositories of evidence-based programs, and we need to make sure that those are the programs that are put in place. I think one of the most challenging aspects of doing effective programs has to do with the coordination, and having a coordinator can be greatly helpful. A school health council also to understand we have different players implementing different kinds of programs, but everybody's working toward a common goal. And one of those goals should be facilitating high levels of community involvement support and integrating different services and coordinating the services for individual students. Our children are ill-served by the silo approach, but this is how our infrastructure is set up. This is how our policies, our programs, our funding streams are currently in place. And it's going to be challenging for us to reduce the duplication, reduce the overlap, and get people talking together, working together to help ensure that we meet the needs of our young people, because these problems are interrelated. So solutions that are siloed are not likely to have benefits, and especially in these times of limited economic resources, it's important that we pool our resources and work together. And I'll stop there, Mark. Thank you.
Great. Thank you so much, Dr. Basch. I am going to go right back and jump into the next part where I'm going to ask Alex Scheibel of our office, our policy analyst at Healthy Schools Campaign, to talk about our Health in Mind project and the report recommendations that will be emerging and will be reported on soon. So, Alex.
Great, thanks, Mark. So I think we heard from both speakers just more about the role that schools can play in promoting health and wellness. We heard that for the first time the nation is shifting its focus to one on prevention and health promotion, and the role that schools can play in this. And then from Dr. Basch, that there are these set of educationally relevant health disparities that really must be addressed if we truly want to address the academic achievement gap. And so based on Dr. Basch's research and then our engagement with different stakeholder groups, Healthy Schools Campaign has developed a set of recommendations that we'll be presenting to the Department of Education on May 9th around what the Department of Education can be doing to promote health and wellness and to recognize that health is an integral component of a child's successful academic life. And so the first recommendation that we've identified is around school health services. We feel like school health services can play a critical role in making sure that students have regular access to health care. School nurses, we have seen firsthand just the integral role that they can play in making sure that kids are healthy and ready to learn. Unfortunately, currently the cost of funding school health primarily falls on the education sector. And what we're proposing in our recommendations is to really think about how we can shift that funding to one that's more on provided through the health sector. Specifically, we're proposing a number of changes that would enable school districts to bill Medicaid and get more reimbursement for the services that they're already providing to make sure that there is adequate funding for school nurses and for school health services. And additionally, we really feel like teachers, principals, other school support staff can be health leaders, and current professional development opportunities really don't emphasize that role and provide these individuals with the tools and resources they need to be health and wellness leaders in the school environment. And we've identified a number of opportunities within the Department of Education that can be used to prioritize health and wellness in professional development through different grants programs, and different initiatives that they have going on currently. And also, we really feel like if things are not measured, they are not going to happen. And so we feel like integrating health and wellness into data and accountability systems within the education sector is a really important component for making sure that these changes really do happen. Specifically, we've been having a lot of conversations around how can we integrate health and wellness into the Department of Education's research agenda. How can we get health and wellness on school report cards so that a parent can go on, pull up the report card for their school and see if their school is supporting the health of their students. Finally, we feel that parent engagement is critical, and it was wonderful to see on the poll that a number of you agree with that as well. And Department of Education is doing a lot of great things to promote health and wellness, to promote parent engagement, and we feel like they need to emphasize the role that parents can play in advocating for health in their schools. So these are our core recommendations. There's more about each of these recommendations on our website, which we've sent the link out to and we'll send out again, including detailed background papers that provide research that supports each of these sections. So if one of these issues is of great importance to you, please, we encourage you to go on and read more information. And once again, to sign on in support of our vision for healthier school environments by going to this link. So thank you. And I think now we have a number of questions that have been coming in throughout the webinar, so we are going to go ahead and ask. I know there were a number for Dr. Basch, so I'm going to start out with those. First, Dr. Basch, given the childhood obesity epidemic, can you discuss the link between overweight obesity and the ability to learn?
Well, actually, what we see is that there's some statistical association there. And my review of the research was to try to understand, well, how and why would that occur? And I think that when you think about, well, how do you address childhood obesity? And I think that the way you address childhood obesity on the positive side is through diet and physical activity, and obviously through greater accessibility to healthful foods. But in terms of actually the causal connections for how and why obesity per se would affect learning, there wasn't a lot of research. There's some speculative research on how it may affect bullying and likelihood of being bullied. There's some research on perhaps a propensity to feel more depressed at times, but the reason it wasn't included on my list was because there wasn't the strong evidence of causal effects on educational outcomes. Nevertheless, I think it's clearly a major problem, and but think, how would you address that problem through schools? The way that you would address that problem through schools is by making sure that schools help ensure that.
Great.
All children, not just the most athletic ones, a lot of opportunities for vigorous physical activity, and that the food served in schools is healthful foods, which it too often is not.
Okay, great. Thank you so much, Dr. Basch. Rich, if you're still with us, I know Rich might have to leave a little early, but we had a couple questions come in about the community transformation grants. Specifically, are they still available? And if so, where can grant information be found?
The grants are still available. The action plans are just being finalized now. There are project directors for each of the grants, and then for this coming year, this next fiscal year, there's an additional $80 million available. So there will be another FOA, a funding announcement out in the next couple of months. And if they follow the congressional direction on that, all of those grants will likely be available directly to non-governmental organizations. So there is a website. If you go to the cdc.gov, there is a subpage or series of pages on the community transformation grants, and it'll give you details on who the grantees are and what programs they're working on, et cetera. You can also get some of that information from going to our website, which is Healthy Americans, www.healthyamericans.org/health-issues. And we have all kinds of details on the Affordable Care Act and a whole section there on the community transformation grant.
Great, thank you. So another question for Dr. Basch, on a related note kind of to the obesity question, is we've had a number of participants request more of an explanation on the role that nutrition plays in children's ability to learn, and specifically breakfast consumption. So elaborating a little bit more on that link that you mentioned in your presentation.
Okay. Well, one of the things that I think is really important to keep in mind is there are people all over that are specialized in different areas. Some are focused on obesity, some are focused on diet and nutrition, some are focused on violence prevention, and I think one of the things that we have to get away from is this notion of trying to really isolate the specific effects of these individual factors, because what we've learned is that there's synergistic interactions between these different kinds of factors like diet and physical activity and sleep. And that's why the research has shown inconsistent results, because if you look at one thing and you don't control for these other things, it's unlikely that you're going to always see the same effects. So it seems pretty obvious that good nutrition and having a good breakfast is an important part of overall human development. The research clearly shows that breakfast in particular and a healthy, balanced diet in general affects your brain chemistry and your ability to think well and to maintain alertness and not be distracted. So it's clearly one of the important pillars as part of an overall comprehensive approach, coordinated approach. And I think it's really important that we keep emphasizing this, is that while each of us may have our particular expertise, the importance of having really addressing a set of factors simultaneously. And if we don't do that, if we continue to have these categorical programs, I think we're going to really miss important opportunities for really benefiting young people.
Great. Thank you, Dr. Basch. Another question we have, which I'm actually going to direct to Mark Bishop at Healthy Schools Campaign, is that the EPA has just published a draft document on guidelines for K through 12 school environmental health programs. Have you seen this document, and do you have any comments on it?
The short answer to that is we have seen it. We have read it through very extensively, and we do have comments. We're currently crafting our specific recommendations. EPA will be, we're hoping to submit those comments next week, at which point we'll also make them public and available for other people to review. In short, though, we're thrilled that the EPA is taking the time to move forward and create these documents, these recommendations to the states. They were tasked with the requirement of helping states develop programs to implement environmental health guidelines. The biggest, in a very general area of concern, was one of the opportunities that they had was to really review a state policy environment and to look at the different policies that states have that would support environmental health. We don't feel like they went far enough. And while there are many opportunities in this document for them to say, let's review the inventory of policies and how that actually ultimately impacts a school environment, they didn't do that. And we think there are we think there are places where that can be added very quickly, that can make a more effective document, and we'll be making that public hopefully in the next week.
Great, thank you. And I think we're going to take one final question, which Dr. Basch might be able to answer. Healthy Schools Campaign, I think, can probably provide input too, but it's just, do you have suggestions for resources about how school nurses, teachers, principals can, or I guess less so principals, but school nurses and teachers can make the case to their administration to build support for health, to emphasize what you spoke to around the health and learning connection, and resources to build support for that and for healthier school environment?
Well, one of the resources is the report that I originally developed in 2009 called Healthier Students or Better Learners. That report, which was published as a special issue of the Journal of Journal of School Health in October 2011, can be downloaded by anyone in the country, or for that matter the globe, for free. And that really provides the evidence. And the message that we want to get across to educational administrators and policymakers is that if we don't address these factors, it's going to greatly jeopardize the other efforts that they're attempting in their school reforms related to curriculum, related to teaching effectiveness, related to accountability and standards and data systems. And these factors really need to become a fundamental part of the mission of schools. The resources, there are other resources through the Healthy Schools campaign. The Division of Adolescent and School Health at CDC was a great resource. Still, there are many great resources through the Centers for Disease Control, which is one of the few federal agencies that's really taken a very highly coordinated approach to this problem. So I would direct you to those resources, and perhaps you can post them on your website for people.
Great. Thank you. I think we're going to wrap up. We're a little bit over time right now, so I want to thank everyone for sticking in there. There are some questions that weren't completely answered. Let me assure everyone that we are going to post the archive of our webinar as well as the presentations and links to a lot of the resources that were discussed. They will be up on the website. We're hoping by the end of the day tomorrow. That's our goal. So I want to say thank you again for joining us. Remember that we have 3 other spring webinars coming up if you're interested in learning about specifically our recommendations for school nursing, and then 2 others that are specific to the school food environment, innovations around healthy school food, and the small business side of school food. So please share, let people know that this is going on. Again, thank you for your participation, and we look forward to hearing from you all next time. Thank you.